Hello and welcome. I'm Diane Dunn, National Eczema Association Vice President, Programs and Communications. We see that people are still logging on and want to give them a few moments to join us. While we're waiting, I want to make sure you all know about the upcoming National Eczema Association Patient Conference. Our 2014 Patient Conference will take place in Boston on July 10th through the 13th. We're hosting the conference in collaboration with the Departments of Dermatology at Boston Children's Hospital, Beth Israel Deaconess Medical Center, Brigham and Women's Hospital, and Massachusetts General Hospital. The conference features eczema experts speaking on skincare, research, alternatives, and a host of other topics. There will also be treatment discussion and product information. The conference features both kids and teen camps. The camps are for youth with eczema, their siblings, and friends. The conference offers not only eczema experts, but also the opportunity to be surrounded by people who understand what you and your family are going through. Registration for this year's conference will begin in mid-March. Okay, it looks like we're ready to start. For those of you who have just joined us, welcome. I'm Diane Dunn, Vice President of Programs and Communications at the National Eczema Association. I'd like to welcome you to the National Eczema Association's first Eczema Education webcast. Today's event is Eczema Skincare Winter Solutions, presented by Susan Tofte of Oregon Health and Science University. The National Eczema Association is a nonprofit organization and the only organization dedicated solely to eczema sufferers and their loved ones. We represent more than 30 million Americans who have eczema. Our mission is to improve the health and quality of life for individuals with eczema through research, support, and education. We do want to encourage you to get involved with the National Eczema Association and help raise awareness about this disease. A few things you can do include attending the 2014 Patient Conference in Boston this July, raising awareness during Eczema Awareness Month in October. We have materials and supplies to help you with any event you'd like to do. Participating in our Itching for a Cure walk, either by walking with us in person or by being a virtual walker and raising awareness in your own community. We're thrilled to announce that this year's walk will be held on Sunday, October 5th on the beautiful UCLA campus in Los Angeles. You can also host an event any time of the year to raise awareness. You can visit the Get Involved section of our website at nationaleczema.org for ideas. I'm so pleased now to introduce our webcast presenter, Susan Tofte. Susan Tofte is a family nurse practitioner who works in the Department of Dermatology at the Oregon Health and Science University in Portland, Oregon. Ms. Tofte sees medical dermatology patients, including many with atopic dermatitis or eczema and other inflammatory skin diseases. In addition to seeing patients, Ms. Tofte is also part of the research team in the university's dermatology department, where clinical trials are conducted. Many of the department's clinical trials are designed for patients with atopic dermatitis. Ms. Tofte has served on the board of directors for the National Eczema Association for many years and volunteers for National Eczema Association patient-centered events, including the Patient Conference and the Itching for a Cure walk. Ms. Tofte is a past president of the Dermatology Nurses Association, a professional nursing organization comprised of more than 3,000 dermatology nurses in the United States. Ms. Tofte has lectured both nationally and internationally on atopic dermatitis and has many professional publications. We're so fortunate to have Susan Tofte with us today. Ms. Tofte, welcome and thank you for presenting this Eczema Skincare Winter Solutions webcast.
Thank you very much for that lovely introduction, and I am very happy to be part of this first webcast for families and patients that are interested in learning more about atopic dermatitis. So we all deal with different skin issues, particularly during the winter months. And people with inflammatory skin diseases like atopic dermatitis or eczema have more problems than those who don't have skin disease. And the reason being that skin dries out more in the cold winter weather. There's a lack of humidity in the air, and this causes people with eczema to have more flare-ups during those colder winter months. The heat that comes on in the house in most of our homes in the wintertime adds to that dryness, and then that dryness creates a vicious circle that contributes to the eczema flares. Also, stress and illness like the common cold or flu season can also contribute to eczema flares. So I'm going to try to address each of these as we go. So talking about some key points to eczema skincare, I'll talk about bathing and moisturizing, or as we've sort of dubbed it, soak and seal, ways of taking baths and getting your skin hydrated and being able to seal that hydration in by appropriate use of a moisturizer. I'll talk a little bit about use of topical medications and use appropriately as directed by your provider. And then how to manage itching and scratching. We know that it's a big problem, and that the hallmark of the disease for atopic dermatitis is itching, and then that leads to scratching, and certainly drier skin in the wintertime exacerbates that and makes it worse. So I'll talk about just some practical tips about how to manage this. Many of you already have a lot of ideas and tools under your belt about how to manage your disease, so I'm hoping that some of these ideas might be new for you and add to your current knowledge about how to manage your disease. So I'm talking first about hydrating the skin, and it's really important to hydrate the skin for somebody who has atopic dermatitis. Their skin barrier is compromised, and they tend to have a much drier skin. So we like to hydrate and give more moisture to the skin, particularly in the winter months. So soaking in a warm or a cool bath, whatever feels better, avoiding those really hot, scalding baths for 20 to 30 minutes. And patients sometimes ask why 20 or 30 minutes. Is there some reason for that length of time? And generally, that's the amount of time it takes to hydrate the skin. So you look for pruning or wrinkling of the fingertips, and that generally comes on when you've been in the water for about 20 minutes. And it means that your skin has then absorbed the maximum amount of hydration. It's also a way of gently debriding and removing bacteria from the skin. And it also can be a really fun and relaxing time for both children and adults, a way of bonding at the end of the day. I had a patient with severe disease who came in, an adult patient who came in the other day, and the first time I had given him instructions about how to, take a bath twice a day, he wasn't buying into it and didn't want to do it. But the second time he came in, he decided he needed to take the time and do that. And when he came back, he looked at me and he said, "You were right." And he said, "Actually, it's a very relaxing thing for me to do." So kind of think of it in those terms. A swim instead of a bath is another way of negotiating, perhaps with a child, to get in the water, so that's appropriate. And then showers are adequate when the skin is mild and well controlled. So talking about bath additives and whether it's okay to add things to your bath water, you certainly can add some softening products to the bath, like oils or oilated oatmeal or some of the oatmeal salts and other types of salts, avoiding always those that have heavy fragrance or perfume. Sometimes when the skin is really broken out and there are some open areas or weepy areas, even plain water hurts the skin. This is particularly true for children. So sometimes adding table salt to a tub of water can make that water more physiologic like our normal body fluids, and actually is a little easier to get into the tub when your skin is broken out. So that's a good tip to be able to try. If cleansing soap seems too drying to the overall skin, you can just limit it to only use it in the underarms, the groin, and the toe webs, and just use plain water in some of the other areas. And then lastly, always use a very soft washcloth or a sponge and gently rub it over the skin without rubbing vigorously or creating a scratching type of movement over the skin. Moisturizers are so important, and I always teach my patients that they should be creamy or greasy products. And they always work best when they're applied within 3 minutes of getting out of the water while the skin is still moist. So getting out of the water and barely patting those excess water droplets off the skin, but leaving the skin feeling moist, is the best way to get moisturizer into your skin. Moisturizing protects the skin from drying out, and which can cause cracks to form in the outermost layer of the skin. And then once you've impaired that skin barrier, there's the potential to allow bacteria, possibly other organisms, an entry into the skin. And for people with eczema or any inflammatory skin disease, the use of moisturizers is especially important during the winter months. So I always show patients, and I'll show you a slide later, how to remember that creamy or greasy things come in jars. And I'll show you examples of that in a few minutes. So again, types of moisturizers. Creams tend to be the lightest type. They contain more water and less oil. They're often packaged in 1-pound jars, which is very convenient if you're using something every day, and can be found at most drugstores. Ointments tend to be the thickest and the greasiest of all emollients. They contain more oil and less water. These are things like Vaseline, the greasier products. Oils are best when used as a bath additive. Generally, they're not enough to be used after the bath as an all-over moisturizer, but sometimes perhaps mixing an oil with a cream will give a patient the best of both worlds, if you will, and they'll be able to apply it over their skin. But generally, oils are just not going to be enough to be applied immediately after the bath. Avoid lotions, which generally come in pump bottles or in bottles that pour. These are much more liquid. They contain more alcohol and more water, and they are just overall more drying for eczema skin, particularly in the winter time. Sometimes, depending on where you live, in the summer months, you can get away with using a lotion, but in general, we tell our patients to avoid using lotions. So how do you pick the right product? There are certainly large numbers of products available. Many moisturizer options are available, and they all have the potential to be helpful. So the most important piece is to choose one that you like and that fits in your price point. And the most important thing is that you're able and willing to use the moisturizer regularly. Sometimes if a child or an adult, for that matter, comes into the office and they say that whenever they put a certain type of moisturizer on their skin, it makes them feel itchy or they don't like the way it feels, we'll do a test in the office and actually put a greasier thing on one side and a creamier thing on the other side and let it sit for a little while and see if they can manage it that way. But sometimes it's a matter of trial and error and just finding the moisturizer that fits with your daily activities and that you know you can use regularly. And this is a personal choice. It'll be different for everybody. There are lots of moisturizing ingredients in these moisturizers, so you're bound to see things that are called shea butter, aloe vera, glycerin, lanolin, beeswax. Menthol is added to many anti-itch emollients, so those are some of the ingredients you're likely to see. Additionally, colloidal oatmeal, petrolatum or petroleum, oils including vegetable oils and mineral oils, and vitamin E might be on the ingredient list. This is the slide I was talking about earlier that shows there are many choices available for moisturizing products. I chose these and took a slide of them because they show that these products come in 1-pound jars, and they're all, this emphasizes how scooping something out of a jar means that you probably have an ointment or a creamy product, which is better for the skin, particularly in the winter months. Most of these, if not all of them, are available over the counter at any drugstore. And again, I like them because they come in large jars. You don't run out of them quickly. There are others, but these are the ones that, that I had handy to be able to demonstrate. I'm going to talk a little bit about barrier therapies because having atopic dermatitis means that you have an impaired barrier. Your skin is drier, it doesn't hold water well, and the barrier is compromised. So research has shown that protecting the skin barrier is essential to maintaining healthy skin. There are many skincare products available that are marketed now as barrier products. And the term ceramide is often associated with skin barrier protection. So what are ceramides? They are a family of waxy lipid molecules found in normal skin, but thought to be deficient in eczema skin, and thereby being part of the barrier problem that eczema skin has. They are marketed sometimes as a replacement to natural oils or as an anti-aging product, because as we age, we lose our natural oils and we lose our natural elasticity in our skin. And they're also marketed to protect and moisturize the skin. And there have been studies that have shown that ceramide therapies can help eczema skin. So barrier therapies are thought to be very helpful in terms of protecting the skin and giving it a better, more protective barrier. I'm going to talk a little bit about occlusion therapy and what that means and whether it's appropriate for you. So occlusion means covering over a topical product for the purpose of increasing its effectiveness and absorbency into the skin. Occlusion is generally only used for those thicker areas of the skin or of eczema, and generally this would be on the feet, the ankles, or the wrists. Thinner skinned areas on all of us, whether we have eczema or not, is our face and our neck and our buttocks, and those would generally not be places that you would apply a medication and then occlude. So think about it where the skin is thicker and can more safely be occluded with a treatment. And a topical product then is applied to the skin and then covered over with a plastic wrap or saran wrap, cellophane, or some type of waterproof dressing, and often will be left on overnight that way. A sauna or a nylon suit can be used to enhance penetration over the entire body. More than likely, a moisturizer used this way, or occasionally under supervision, medication over large parts of the body might be occluded over by use of a sauna or nylon suit. This is an example of what I meant by thicker skinned areas. So this is a young girl in my clinic who has severe atopic dermatitis, and she tends to rub her ankles and feet together. They bleed and become very thick where the accentuated lines on her ankles are from chronic rubbing and scratching. She probably does a lot of this just rubbing her feet together at night. So occluding an area like this will help get the medication or the moisturizer into those areas a little more deeply to where they'll really do some good for her. Otherwise, it's harder, as the skin gets thicker, it's harder for things to penetrate and get through those thicker rubbed, and we call them lichenified areas. This is another example, a little less severe, but you can see the accentuated lines on the ankle and foot of this young patient where they have rubbed and scratched this area. The skin becomes almost leathery because it's gotten so thick and very typical are areas on the feet where people tend to rub without even realizing they're rubbing and scratching. So this would be an appropriate area to occlude under supervision to get the medication or moisturizer through to the areas a little bit better. Always check with your provider before occluding any area, especially over a prescription medication. You wouldn't want to occlude over thin-skinned areas because medications can overabsorb into the skin and then lead to unwanted side effects. So only should you check with your provider about those areas you might be concerned about, feet or ankles, wrists, or thicker skinned areas on the extremities. And again, medications under occlusion, it's generally for a very short period of time, perhaps a week, and only at night. And then moisturizers can also be occluded overnight while sleeping, or even just for a few hours before bed. Any type of topical product that's put on the skin is enhanced under occlusion, and also gets in better if the skin has been hydrated adequately, as we talked about previously. I'll talk a little bit about wet wrap therapy. Especially for young children who have extensive involvement, getting into water, as I mentioned earlier, even plain water hurts the skin when it's really broken out, and it becomes somewhat of a battle between parent and child in trying to get into the water. So for those patients, wet wraps can be very helpful, and it's an effective and acceptable alternative to hydrating broken out skin or very dry skin. And one really simple way of doing that is to use wet pajamas and then cover over with a dry pair. Leave it on for about an hour. That will hydrate the skin as much as they're going to. After you remove them, while the skin still feels damp, apply medication or moisturizers as appropriate. Some institutions have other types of wrap therapy, such as gauze dressings or cotton strips of fabric that would be an alternative to using the wet pajamas. And some other methods of wet wrap therapy involve applying medication and then putting wet wraps over the top of them for a period of time. Wet wrap therapy, again, has its place, particularly if it's become a battle to try to get into a tub of water or try to get hydration into the skin. So particularly when the skin is very inflamed, but they are difficult and time consuming, and getting into a tub of water is probably easier for most people, but certainly wet wrap therapy has a place as an alternative. And as the skin heals and those areas become less painful, getting into water then can be easier. So this might be something you do for a few days to get the skin more healed and less open, and then the child or the patient is able to get into a soaking bath. This young child has extensive involvement in behind the knees, a typical place where we see eczema. And this is the type of patient that I'm talking about. This would probably hurt to get into water right now. So perhaps doing wet wraps or having her get into wet pajamas and hydrating the skin that way, getting the medication on. And then as these areas start to heal, getting into water will be much easier for this child. So a word about soaps and shampoos. I often get a lot of questions about what types of soaps to use, and we're not very particular about soaps, but lean toward things that are gentle and mild, that don't contain perfume or fragrance. There are many liquid and bar soap choices available. Many of them now are marketed as moisture therapies, or they have a moisture additive. Those are perfectly fine, and they may add a little moisture to the skin, but they are not a substitute for skipping moisturizer once you get out of the bath. So it's fine to use them, but probably not to use them on not to skip your moisturizer after you get out of the tub. Scott, I've lost my slide here for a moment. There, okay, thank you. It's back on, sorry. So looking for a gentle, mild cleanser that doesn't contain perfume or fragrance. Again, the moisturizing bars and liquids are fine. Just in general, avoiding bubble baths. That generally means that there's some fragrance, and so in general, we ask our patients to avoid using bubble baths. Gentle, non-perfumed shampoos are best. And just remember, if you do choose a shampoo that has more fragrance in it, or has, sorry, I lost my slide for a moment there again, more perfume in it, that shampoo will rinse down over the body and come in contact with the skin. So be mindful of that when you're choosing your shampoos. And then always remember to have your moisturizer or medication ready to apply immediately after getting out of the bath or shower. Generally, what this means is that you have the jar of moisturizer open and medication ready there in the bathroom, so that when you step out, barely patting that excess water off, leaving the skin feeling damp, you have it ready to put on while you're still in the bathroom. Itching, of course, is a big problem, and there's no easy answer for it. I never tell patients to stop scratching because I know that itching is fairly uncontrollable, but we can make it a little bit better by helping to reduce the inflammation in the skin, and as the inflammation goes down, the itching should go down. It's a major problem for all of us, particularly when there's a big flare-up, and we don't know of any true cure for itching other than treating the inflammation of the eczema. So treating it with the topical medications and moisturizers, adding hydration to your skin. So medications and moisturizers, when they are applied quickly after coming out of the bath or shower, help reduce that overreactive and inflammation on the skin. And then as the redness goes down and the skin starts to heal, the itching gets better. Sometimes using a sedating antihistamine at bedtime can be helpful to sleep more soundly without scratching, but I usually am pretty clear about telling a patient taking an antihistamine doesn't shut an itch button off. No such thing exists, but it can help you get a more restful sleep. There are lots of anti-itch products and ingredients that are over the counter. So those weaker steroids, hydrocortisone 1%, available over the counter, marketed as Cordate or Cortisone 10. They're available, and they are marketed as anti-itch medications. For people who have very severe disease, I usually tell them it's not worth their time and money because they just aren't going to be as effective. You're better off going with whatever your provider recommends. Some anti-itch products might be soothing to the skin temporarily, but use them cautiously. There may be ingredients that are going to cause problems, and there may be sensitivities that would cause itching to be worse later on. So it's always best to check with your provider before you try a new product. Other tips for considering over-the-counter treatments. Always read the ingredient label. If the advertisement or something on the bottle says miracle, miraculous, cure, or breakthrough, be very skeptical about that product. If the label instructions don't explain how to achieve all the acclaimed benefits, be suspicious. And the old adage, if it sounds too good to be true, it probably is. So lots of patients turn to alternative therapies. They don't like that they have to use steroids all the time, or even the mess and the greasiness of using moisturizers. So we have patients who start to look outside and look for other things, and perhaps a friend or a well-meaning family member comes back with a product that they found while they were traveling. And then, go ahead, the next slide. And they think they're safe, but they actually can contain in this particular case, this contains a fairly potent steroid, and the patient thought they were using something that was alternative, more natural, and it turned out that they were using something that had potent steroid, and they may at that point be using it inappropriately. So be careful when you look at alternative therapies, and it's better if you check with your provider about whether this is going to be safe to use day after day. There are ingredients to avoid. Again, fragrance or perfumed products, things that have alcohol or too much alcohol in them. Skin sensitivities vary, so pay attention to how a product affects you and discontinue if you experience increased redness or itching. Sometimes just trying a product on a small area of your skin is a really good idea. I often recommend that. Just use this on a small area, and if you think it's going to be okay after several hours, then go ahead and put it over larger areas of your body, but perhaps holding off on something new and don't apply it over a large area right away. And especially look for formulations that are indicated for sensitive skin and for products that have the National Eczema Association seal of acceptance. I'll show you what that looks like in a moment. And then lastly, remember that a product that's marketed as natural or holistic may not necessarily be gentle on your skin. Many of those have products or additives that are sensitizers, and you can become allergic to things that you put on your skin. So be wary, be an ingredient reader, and then I'll show you what the National Eczema Association seal of acceptance looks like. When you see this seal of acceptance, it indicates that a panel of evaluators have looked at the ingredient list. They have looked at this specifically with eczema patients in mind, and they have determined that this product is probably going to be safe for most people who have sensitive eczema skin to use this product. So look for this seal of acceptance. Other tips for managing eczema. Sometimes using a humidifier could be helpful. So adding that, particularly in the winter months when, as I said, the heat is on in the house and things get a little bit drier, significantly more drier, in fact. And so using a humidifier can add some moisture to that air. Choosing clothing that is softer, gentler, soft fibers like cotton. Avoiding those that are less breathable and potentially irritating like wool or polyester. And then just for general health, I always tell my patients to keep up good hygiene, a healthy lifestyle, avoid illnesses that can trigger or worsen eczema. You can do that by washing hands, receiving flu vaccinations as appropriate, and then just general common sense things like getting plenty of rest as well as a healthy amount of exercise, to eat well. I always tell my patients those are good things for your heart health and your lung health, and then your skin is the largest organ in your body, so doing all of those healthy things is good for your skin as well. Other tips for managing eczema. Again, showers are fine when the skin is well controlled. And sometimes patients have that idea that they should be avoiding water or only taking a 5-minute shower a couple of times a week, when actually your skin needs more hydration. It's very dry and it needs the hydration. So twice a day is fine, or when the skin is mild, taking a shower every day for an amount of time that you're comfortable with is fine. When flaring, again, tub baths are recommended 20 to 30 minutes in warm water twice a day. So hydrating that skin twice a day and then getting your moisturizers on. Staying in the tub again till the fingertips wrinkle, which is the indicator that you've absorbed the maximum amount of hydration. And then immediately within 3 minutes, getting your topical medication and moisturizers on, generally while you're still in the bathroom. Avoid hot or scalding baths or showers. I know patients who have used a scalding shower just to get temporary relief of itching, but in the end it's very drying to the skin and ultimately can damage the skin barrier, so it's not recommended. Work with your healthcare provider about any topicals you're using for your eczema. If you found a new product and you have questions, It's okay to take it to your provider and have them look at the ingredient list. Even over-the-counter medications or over-the-counter products can have the potential to interact with other medications that you might have been prescribed. So have that conversation with your healthcare provider. And then don't let your skin get out of control. If you feel that you've used all the tools that you know to keep a flare under control and it's still going, then schedule an appointment with your healthcare provider before it gets to the point that it's out of control. It's much better to come in to get some additional medication or help before things get out of control. There are other resources that are available, lots of skincare information on the National Eczema Association website, nationaleczema.org, and also you can find that list of products that have the NEA seal of acceptance.
Thank you, Ms. Tofte, for a highly educational and well-presented webcast. We now move on to the question and answer portion of our event. Thank you to everyone who submitted questions. While we can't get to every question, we've selected the most frequently asked from today's attendees. So we'll start out with a question from Janelle, who asks, what is the best way to avoid outbreaks during the winter?
Well, as I was suggesting, there are several tips. Using a humidifier. The basic skincare soak and seal is important any time of the year, but particularly in wintertime. So I suggest that you have a regimen, and a clear regimen that you know perhaps each time of the day that you're going to be soaking in the tub. Make it a fun time for kids, and then using good emollient therapy and medications as designated by your provider.
Great. Okay. Next question is from Rosemarie, who asks, can you address hand eczema? Mine is especially worse in the winter when I am washing my hands more often to avoid flu and colds.
That's a great question. And yes, we all do wash our hands more in the wintertime, and it's a good idea with the outbreak of flu that's been especially rampant this year. So when I see patients who have hand involvement, I suggest that they always have a moisturizer. There are a few that are designed for hands, and I would suggest that you pick one that you have with you at all times. I have them in my car. I have them in my purse. I carry them in my pockets, in my lab coat pockets when I'm at work. And every time I get my hands out of water, I dry them. But while they're still slightly moist, I put a good emollient therapy on my hands after every hand washing. Lots of people get little cracks in the fingertips during the winter time, and using a good moisture therapy every time that you wash your hands is so important. And then at night, something I put on my hands at night because I wash them so much in a clinic setting is a thick, greasy emollient product. Sometimes I will even use vinyl gloves over the top of that puts that moisture, penetrates into my hands more deeply at night. So really good moisturizers. Protecting your hands from cold, so when you go outside, always have gloves to put on your hands, and just working at it after every hand washing, always having something handy to put on.
Those are great tips. The next question comes from Elizabeth, who asks, how often should someone with eczema bathe, and how often should I bathe with bleach?
That's a great question. So for flare-ups, when the skin is quite flared up, and sometimes that happens more for patients in the wintertime when we're drier. So my recommendation is to use a tub bath twice a day. Now, if I have a busy working mother who has children to get off to school and she can't do that, I'm very sympathetic to that. So I might say if you can take a shower in the morning, but then use your time in the evening to take a tub bath. So if you're flaring for 1 week, to do a soaking tub bath twice a day and then applying appropriate medications and moisturizers is the best. And that's a really good way to get your skin back under control. So if patients are busy, and most are, I usually emphasize that you only have to do this for a week. And in a week, this will be much better. and then you can perhaps go on to just needing to take showers. Now, in terms of adding bleach to a bath, I will have patients add bleach, and I believe the increments are 1/4 of a cup of household bleach to a tub of water. If they tend to get repeated staph infections, that can be a way of decolonizing the staph. And if that's happening, probably not every day, but using a bleach bath a couple of times a week if you're concerned about that. And check with your provider to see if you actually are having repeated skin infections that perhaps need something more than a bleach bath.
Okay, the next question is from Amelia, who asks, do you have any suggestions for severe itching on a 13-month-old?
That's a tough one. So because a baby doesn't really understand when they're what's happening with their skin. So again, I would go to that bathing twice a day. It's okay to get your child in water. If they're scratching over their head, you can't obviously immerse that part in water, but being able to put a wet compress perhaps over the scalp and hydrating it that way, and then getting the medication and moisturizer in. It's okay to put medication on a scalp of any age. And then if the child is itching so much and their skin is so broken out, again, those wet wraps or using wet pajamas and hydrating the skin first to try to get as much hydration, and then putting the moisturizer or medication on afterward. Check with your provider about possibly using an antihistamine that might help them sleep a little better at night. But usually if you can get their skin under better control, the itching should be less.
Okay, great. Our next question is from Sajivan. Is there any research going on to find a solution for itching?
That's a great question, and yes, the answer is yes. There is a lot of research going on about how to get to better solutions to control itching. For right now, we know, as I've said before, that reducing the inflammation in the skin is going to make it less itchy. It's going to settle those inflammatory cells down, and as the skin heals, the itching gets less. We know that itching is the hallmark of this disease, and it's what people are most bothered by. So I can tell you, yes, there are lots of projects going on, there's research going on, and hopefully there will be new things on the horizon that will help combat itching.
Okay, and now Allison asks, what works better with severe eczema, creams or oils?
I think I addressed this in the slide or some of these during the talk, and again, oils are probably not enough. So if you like oils or you have a particular oil, I've heard patients even talk about using olive oil on their skin. But so if you like that, I think mixing it maybe with your cream might give you the kind of balance that you want. But I think an oil alone is not going to be enough. So using cream and or a mixture of both. But in general, for patients who have atopic dermatitis, a creamy or greasy emollient is going to be better than just using an oil.
Okay. Chi Yu asks, what should I do when lotions and creams don't moisturize enough?
That is a problem. So again, lotions are going to probably mostly have more alcohol and water in them. So, you can identify, they say lotion on the front, and they are generally in pump bottles and things that pour. Those are not going to be moisturizing enough probably for anyone with eczema. The creams tend to be better, but if you find that that's not enough, then going the next step to something like Aquaphor or plain Vaseline, very greasy products, but if you're comfortable using something like that, I would caution using that on an infant just because they're slippery when you put something that greasy on them. But a greasy emollient is probably the best of all if you can tolerate that.
Okay, great. Now we have a question from Charles, who says, my son's itchiness seems to have increased during winter. what are solutions or creams, oils that do not burn for winter relief?
Oh, that's a great question, and it's very true. The itching is worse, and the skin is drier in the winter months. So sometimes if it's hard to get in the water, I talked about using wet wraps or using wet pajamas. The other thing that's sometimes fun for kids, giving them the option of swimming. Chlorine in a pool is not going to be too drying as long as you shower it off afterward and then apply moisturizers. Sometimes letting a child even wear their clothes into the bathtub is kind of fun for them, and it protects them. But they really need that hydration, so you really need to get them in the water to minimize the dryness and the itching, and have all your products available to be able to apply immediately after getting out.
Okay. And Paula asks, how can you prevent, or do you have any tips to prevent unexpected flare-ups?
Well, kind of that healthy lifestyle, and paying attention to it, knowing that if your child gets a cold, that's probably the most common reason for a child, or for an adult patient for that matter, to have ongoing issues. If there's no cure for the common cold, so knowing that your skin is probably going to need a little extra care during those months, or during that or that time that you have that viral illness, to pay extra attention to being aware if you see possible signs of infection on the skin. Those are all things that can allow the skin to flare and to continue to flare. So just being really in tune and getting plenty of rest, eating well, doing all those things for a healthy lifestyle are going to be good for your skin in general.
Okay, great. And Alyssa asks, are there any natural oils that I can use for eczema on my hands?
Again, the oil question comes up a lot, and they're generally, oils are just not going to be enough, and I would say particularly not for the hands, because the skin on the hands is so thick that, because we use our hands all the time, so our skin on our hands is much thicker than other areas of our body. So in general, the oils are not going to be enough to moisturize and to get through to the skin to be able to moisturize it and prevent cracks and drying out from the skin. So in general, I would avoid oils as a moisturizing product for the hands.
Okay. And we had another question about hand eczema from Rachel, about that most of her eczema is able to go into brief remission other than her hands. And are there any suggestions for clearing her hands?
That is a really, it's a good question. It's a tough problem, because a lot of times as adults get older and they, or from childhood, maybe had extensive disease as a child, and then maybe outgrow it for a period of time or don't have problems, and then suddenly they've got it back on their hands as an adult, and it's only on the hands. There are lots of treatments. I would talk to your provider about different things, occluding the hands with gloves. I caution people about using cotton gloves at night, because cotton tends to absorb whatever you're putting on your hands. So I prefer that if you're going to occlude your hands, occlude a moisturizer or a medication under the advice of your provider, that vinyl gloves are better. And even if you are able to use them for a few hours, if you have a lot of hand involvement, then putting the gloves on all night might be a problem, but even for a couple of hours in the evening can be helpful.
Okay, great. Well, thank you so much, Ms. Tofte, for an exceptional presentation. So many helpful tips and just great educational information.
You're welcome. And I know, I did want to say, Diane, that there were a lot more questions, and I would encourage anyone who wrote in that didn't get their question specifically answered, that they try to attend the patient conference in Boston. There will be a wealth of knowledge and information that will be passed off at that, or contact the Eczema Association. There is a wealth of knowledge that they can provide for you as well.
Absolutely. And at the conference, there are also hands-on demonstrations. Thank you all for attending our first eczema education webcast today. We have a series of 4 webcasts planned for 2014. Our next event will be addressing eczema research and will be held in the spring. To make sure you're notified of upcoming webcasts and other events, sign up for the National Eczema Association's free electronic newsletter on our website at nationaleczema.org. On behalf of the National Eczema Association, thank you and good evening.